Thousands of Texans fear they will lose therapy services in less than 2 weeks. It's all because of our elected officials cutting millions of dollars from the amount the state pays for speech and physical therapy. KXAN's political reporter Phil Prazen was there today when the Health and Human Services Commission heard testimony on how these cuts will impact lives.
Some cuts lower taxes, some cuts bring tears.
There are over 60,000 children that will be affected from these cuts. And more of these children are born every day.
Therapists and parents of disabled kids came to testify.
The changes that are proposed affect our family very explicitly.
People filled this auditorium at the John H. Winters building. Still more watched from the hallway.
We don't have to be here. The tragedy of this whole thing is that we don't have to be here.
In 2 weeks, taxpayers will spend $50 million a year less for therapy services under Medicaid, a change that's bringing fear.
Our children are the ones that suffer, you know?
Frustration.
These kids, not only for now, but long term, are going to be affected by not having therapy. Very emotional.
And scorn.
To either save our children's lives or save your money, which will you choose?
Just budget numbers before, they now become very real. Now, we obtained letters from the top budget writers in both the House and the Senate. Now, even though they voted for the cuts, they warn HHSC that if these cuts limit access to care, we could be facing legal action from the federal government. Phil Prazen, KXAN News.
The decision to cut Medicaid funding came after a study found Texas pays in some cases 3 times as much as other states for some therapy. For the first time ever, health care will make up the largest part of the Texas state budget. Medicaid funding alone is around $60 billion. The Texas Public Policy Foundation says the federal government controls much of Medicaid, so rate reductions are some of the only ways states can control the costs.
Lawmakers did the best they could with the information they had, but the fact is we don't want state lawmakers or state bureaucrats to be setting rates. We want the rates to be set by the market and by the consumers.
The new rates roll out on October 1st. Charles Schwertner of Georgetown is chair of the Health and Human Services Committee in the Texas Senate. We have reached out repeatedly for comment. We have not heard back from him. Well, the Texas Association for Home Care and Hospice says last year almost 450,000 Texans receive acute care paid for by Medicaid. HHSC disputes that number, saying it's closer to 240,000. With these 20% across-the-board cuts for therapy money, the association predicts anywhere from 60,000 to 90,000 Texans could be dropped by providers.
Now,